Okay, it's recording.
But thank you so much. All right. So see, we are on a very important discussion. We need to understand that many times we'll come across clients, okay, those who are non-compliant. But see, anyway, the client will run away. Okay, from one doctor to another doctor, from one dietitian to another dietitian. Okay, but what we can do is, you need to understand the fact that you will have only one opportunity with each of your clients. Okay, and give it your best counseling, give it your best dietary advice, give it your best medical advices. So moment the diabetic patient comes, see whatever we are talking right now, in short, you can still compress this entire discussion and you can tell them your sugar has to be between 60 to 120 on fasting basis. Your sugar has to be between 60 to 140 after meals. So titrate it accordingly. Tell them that if in case if you don't follow my instruction, and definitely put this, even if it is a compliant patient, I would recommend you that definitely put this. Tell them that I have been seeing diabetic patients since ages together. Okay, I have been attending seminars on diabetes. Okay, I have been trained under doctors who have treated diabetes, and they have shared their experiences. There have been clients, okay, who have met with vision deficiency or probably some deficit or injury in the vision. Okay, and they basically became blind. There was a client.
You're muted, doctor. You're muted.
Sir, you have been on mute. Sir.
Okay, so somebody use the cam to tell him.
Actually, sir will not able to see us.
Yes, see
Sir,
what happens.
You are muted.
Sir.
You were muted for like 1 minute.
Okay, wait.
We couldn't hear what you said.
All right, I'll resume the discussion once again. Ruchika ma'am has also joined in. Recording is in progress, right?
Yes,
Yes, sir.
recording is going on.
All right. Okay. So my point is always guide to the client that we have been seeing patients of diabetes. We have been attending seminar of diabetes. Okay, we have been under medical practitioners, those who treat diabetes, and these are the complications that can come up. So that in future, when any of these complications comes up, the client will remember the fact that you had guided to the client. One. Second, very importantly, remember that many a times if the client takes good control of the sugar level and he finds another client who is very carefree about sugar, so the client will guide him. He will say, don't do that. You can have paralysis. This was guided to me by dietitian so-and-so. Then what happens is via word of mouth, okay, your goodwill also increases, and somewhere down the line, you are fruitful to the society because you are increasing the awareness of the disease. Because the best way to fight, we would not like patient to have heart attack because ICU beds full with unnecessary excuses, okay, because of something which the patient was not aware of. So why not we increase the awareness of it and we prevent myocardial infarction? Because as it is said in medical line that prevention is better than cure. All right, everybody, are we clear with this point? Please respond to this, yes or no?
Yes, sir.
Yes, sir.
Yeah.
All right, fantastic. Okay, so these are the complications. Now, I'll put down certain more symptoms. Notice this and remember this for lifelong. This is absolutely easy. Okay, absolutely easy. It is, just pay attention. Okay, then there is another complication which is called as diabetic neuropathy. Here what happens is the patient complains suddenly thread-like pain in the body. Thread-like pain. Notice my words. Okay, thread-like pain. The patient will like, doctor, I have a pain along this course of my body. So there is some neuron, some nerve, okay, of the body, which starts troubling to the patient. Okay, pain along the course of a nerve is called as neuralgia. So diabetic patient can complain of thread-like pain. One. That is called as neuralgia, that is pain along the course of neuron. Second, they have constant habit of complaining of burning of body parts, especially burning of feet. Now, most of the time it is seen that in majority diabetic patient, as a coexisting condition, there is vitamin B12 deficiency. And in majority of these cases, whenever the patient complains, doctor, I've got pain along the course of the nerve. Doctor, I experience burning sensation in my palm, burning sensation in my soles. See, these are troubles of neuron. And the best neuron enhancing nutrient is vitamin B12. Vitamin B12 is absolutely deficit in vegetarian diet. Buttermilk is one of the easiest available source of vitamin B12. Now, in a diabetic patients, we doctors very rampantly, we prescribe vitamin B12. Very rampantly. Any patient comes up, says that, doctor, I've got pain along my neck. There are certain cords which are paining. Doctor, I've got pain along my back. Doctor, I feel as if there is a tingling sensation in my legs. I feel as if my feet are burning. Okay, amongst all this group of symptoms, these are all related to neurons, related to nerves. And in such cases, we control the sugar and at the same time, we start with vitamin B12, either the tablet of it or the injection. So remember, that is a diabetic neuropathy. Pathy means suffering, where the neurons are suffering. Then another important point. Suddenly, the great toe becomes black in color. This is called as gangrene. My dear students, this is worst. This ideally happens because of some blood vessel undergoes inflammation or probably calcification. Some calcium gets deposited, or maybe cholesterol gets deposited. Okay. Or some infection comes in. You will not believe, diabetic patient at times has no sensation in the lower extremity. Some parts of the body gets absolutely desensitized. Okay. So it begins with pain along the neuron, burning sensation, then it goes to tingling. Tingling is the sensation where patient feels as if some insect is crawling or creeping inside the body. And then it goes to numbness, where the entire part becomes numb, it becomes desensitized. You will not believe, I have seen diabetic patients, they are walking on the street, okay, wearing their footwear, and they have received a perforated injury by iron nail, which has gone through the footwear into the foot, and the patient is not aware. Imagine. At night at 2 o'clock, that patient comes up, the patient gets out of a public transport, okay, and the bystander tells him that, hey, your feet is bleeding, and he's like, hey, it's bleeding, and then he rushes to the nearby hospital and he comes into it. And then moment he says that, doctor, I did not even come to know this nail has gone through my footwear and it has gone through my foot, and I'm not even aware of it. And then what happens is, we take care of that entire nail, okay, and we manage that local wound. But in the background, we check the sugar of the patient, and we find that the sugar was around 350. Extremely high sugar, okay, and the patient is not even aware that he's having diabetes. So at times, some of the patients, they have this complaint. They are not aware that some part of the body gets injured because there is no sensitivity. The neurons are totally numb. Another point that you should remember, if the foot or the part of the foot becomes black in color, that is called as gangrene. It indicates that part has died. It indicates a tissue death. And there is no treatment that can help. The only treatment in such cases is amputation. We will have to remove that dead, diseased tissue surgically, or else few weeks later you will find this, and the gangrene will spread. In worst cases, it is so unfortunate that we have to do below knee amputation. We have to cut the lower limb below the knee joint, because it started with a very tiny gangrene and the patient was ignorant. He was like, "Theek ho jayega, it will get all right, it will be fine, it will be fine." Time passed by and the disease progressed, the gangrene progresses very quickly. So where we could have just amputated only the great toe, now we have to amputate the entire lower extremity. So you need to tell the patient that your eyes are at risk, your brain is at risk, your heart is at risk, your kidney is at risk. Your upper and lower extremity neurons are at risk. You will experience some pain in the cord-like fashion, or you will experience burning sensation in your feet, or you will experience a tingling, or you will experience numbness, or someday or the other. If you're not taking care of your sugar, then your body parts can become black. That is called as gangrene. And that will need surgical intervention, that is amputation. So see, what happens is when you tell this to your client, when you explain this to your client, I have this habit that I treat less, but I teach more. Okay, I see less number of patients, though I charge them lavishly. Okay, but I spend quality time with them. Because this was told to me by my teacher that make it a point that the doctor who treats, he treats only single patient, but the doctor who teaches, he treats the entire community. Same, I must tell you that spend quality time, because if you're counseling your patient, give good counseling about diet, but in the background, give good counseling about basic physiology of human body. When you tell to the client understands, and the client goes with a knowledge for a lifelong basis. And whenever in any party or in any marriage or probably in any get together, your client comes in contact with few people, then he's like, hey, you should not do this. This can happen to you. You should not do this. This can happen to you. Because I was told by my counselor. And then probably that adds to your chain also. Okay, that probably your hard work, your goodwill reflects back, and via word of mouth, okay, you earn a very good reputation amongst your clients. Am I clear with this? Everybody understood this? Please respond to this.
Yes, sir.
Yes, sir.
All right, perfect. Okay, so we have been through diabetes. We have seen the types of diabetes. We have seen the blood investigation of diabetes, and we have seen the complication of diabetes as well. Now, last 5 minutes I devote. Okay, somebody please take screenshot of this. Last 5 minutes, if there is any doubt which is pending, please let me know.
Sir, I have a question about what diet you would recommend, if you can give a gist to a diabetic patient, if you can suggest according to you.
Right. See, in terms of diet, I must tell you that probably what we can do is I'll connect it to Ruchika ma'am. Ruchika ma'am can give you a better idea about the diet, because I mostly consider the pathophysiological aspect of it, and being a doctor is also, to be very honest, see what happens is there are certain things that we can do, okay, and probably dietitians.
Sir, you are muted again. Sir, you are muted again.
Can somebody show him on the cam?
Oh. Sir,
Excuse me, sir.
In general,
excuse me, sir.
yeah.
Sir, you are muted. Now it is okay.
Okay, am I audible right now?
Yeah, can you
Yes, sir,
repeat like
now you are.
for
Can you repeat the last 2 minutes?
yeah.
Yes. I'll come back. Okay, so the question was what diet I will advise, okay, to a diabetic patient. So firstly, I would like to keep this question in the hands of experts. So I would recommend that you all stay connected to Ruchika ma'am, because Ruchika ma'am does a great job in that aspect. Because that is the forte of a dietitian. Probably tomorrow, okay, you will know dietitian points better than me, because you are totally into that section. However, generalized point of view, what we advise to the patient is, we ask the patient to stay away from sweets. Particularly, we mention now, whichever geographical distribution you are placed into, whichever country you are placed into, mention the food items rather than mentioning the category of food. So for my patients, I'm very keen. I'm like, sweets you should not eat, sugar you should not consume, jaggery you should not consume, honey you should not consume, chocolates, ice creams you should avoid. Other than that, when I come down to fruits also, I'm very particular about it. I say that chiku you cannot consume, banana you cannot consume, mango you cannot consume. And every time you feel like eating this, remember that there is a poison hidden in these fruits and this food stuff, because for you it's a poison. And then when I come down to the balanced diet, there also I'm very particular about it. Depending upon the sugar level, I tell them that you have to avoid potato, you have to avoid rice as well. And other than that, sour fruits you can consume, little bit of dry fruits you can consume depending upon the sugar level. I'm still recommending that the finer dietary management will be better done by Ruchika ma'am. But generalized point of view, as a doctor, as a physician, I must tell you that these are the points which has to be taken care of. Remember that guide to the patient the food items, list the food items. Patient, they like when you list the food items. Rather than saying that you should not eat fats, you should not consume proteins, list the food items and talk in their local language. Okay. Do not sound fancy sitting on the other side of the table. Talk in very silly language which the patient understands. That is a prime quality that you should develop as a counselor. Right? Any other doubt?
Can you also talk about some commonly used drugs that you give for diabetes that you can say we should know maybe?
Right. In terms of diabetes, see what you all will come across is in terms of tablet. See, there is a brand name called as glyciphage tablet 500. It contains this drug called as metformin. So if we go into the pyramid of treatment, okay, then you need to understand as always diet first, followed by exercise. Because see, many a times you will come across certain sugar values which are around, let's say 142, which is around 145, which is around 153. And if the patient is pre-diabetic, that means the patient is just on the verge and freshly detected. There is no past history. Everything is appropriate in the patient and you have just picked up. This patient is like, 150 is like upper limit. Remember in shortcut, it has to be below 150. Below 150. Fasting, postprandial, whatever. Below 150. So moment you detect it, okay, be very firm with the diet. Be very firm with the exercise. And be very firm with the mental health of the patient. Tell him that excess of anger, excess of stress, overcrowding of thoughts, overthinking, being too sensitive at mental level is injurious because the stress also contributes to the sugar level. Now, after that, the next line of treatment is tablet. In tablet, metformin is very common. And most of the times, even if nothing is feasible, then most of the time, metformin tablet, usually in mild cases, once in the morning, moderate cases, twice a day, severe cases, at times it is given thrice also. So this is one line of drug. Other than that, we have other combination drug. Tablet glycinase. Okay, it contains two drugs which are combined together. Now these are higher level of medicines. So what you can do is when a patient comes with medicine, you can read the content of it. Okay. Metformin is a simple and it is safe. So let's say if no doctor is available and you find that the sugar is too high, okay, right, then metformin is the tablet which on an average most of the times, this is the first line of treatment which is done. Achha. Then other than combined medicines like tablet glycinase, we'll not go into the content of it because the content has got very complicated names, not that important. Other than that, last human atrapid injection. These are insulin injections. Insulin injections, if you see the syringe has got a very tiny needle. It is given just below the skin. It is a subcutaneous injection. And in most of the situation, you need only 1 or 2 exposure of it. Okay, once if you give it, then you become absolutely confident about it. The needle does not go deep inside. It will not damage any part of the body. Okay, and into different parts, let's say the upper limb, or at times even in thighs or in abdominal areas. Okay, it can be given in bulky parts of the body, and it has to go beyond just inside the skin. So what we ideally do is, even if you inject it perpendicularly, the needle will not go deep inside because as it is, the needle is very tiny. Okay, still for a better approach, we just incline the needle. Okay, we just incline it and then we insert it. Okay, so the last line of treatment is this. Along with this, let's say, now you will come across this situation and the last part of this discussion, everybody please be attentive. Many times what happens is patient consumes the tablet of diabetes. Now these are tablets will decrease the sugar level. But what happens is Patient has consumed the tablet, but immediately after that, the patient has not consumed food. He has skipped his meals. The meals have been skipped because of office pressure. The boss is like, I need this file urgently. Get it done within 2 hours. The patient just consumed medicine. He was about to eat food. Now he's working on the file. He has skipped his meals. Now, doctors prescribe a tablet considering the sugar level of the patient and every day the amount of meals that the patient will consume. So in such cases, most of the time advice to the patient that have your tablets after food, though these tablets can be taken before food as well. But on a safer note, advice to the client that always have tablet after food, be it whatsoever. Because in that case, what happens is the risk of hypoglycemia can be avoided. Many times the patient takes a tablet. Now he's into some work, he skips his meals, and then there is already low sugar. He was about to eat, so that sugar would have increased and then the tablet would have acted onto the sugar. But since there is no food which has come along with the tablet, the low sugar becomes absolutely low. Patient goes into hypoglycemia. Last point for today.
Sir, what was the upper limit you said was it 140 or 150?
Take it as 150, round up. Okay. It should not go beyond 150. Similarly, the lower limit is 60. If the sugar is less than 60, then the patient will experience dryness of lips, dryness of tongue, dryness of throat, light-headedness, spinning sensation, and the patient will collapse. Guide it to your client that to whichever doctor you are seeing, whatever medicine he is giving, at least tell him that whenever if you experience dryness of your oral cavity, dryness of your throat, light-headedness, spinning sensation, do not take your diabetic tablet. Rather, take a chocolate or take a Glucon-D biscuit or a glucose biscuit or a Glucon-D powder, mix it, or take sugar, mix it into the water and drink immediately. Tell him that, because if you become unconscious, you will have to go to the hospital or the clinic, and their doctor will give dextrose injection, carbohydrates injection. Because ultimately we are trying to increase the sugar of the patient.
The session
Sugar
will
which
end
is
in 2 minutes. The session will end in 2 minutes.
okay, let me just summarize this. Sugar which is less than 60 will cause a dizziness. Remember that. Okay. Anyway, any other doubt? Because even I need to continue with other commitments. Any other doubt, please let me know.
So, doctor, sir, how to know whether the patient is having type 1 or type 2 diabetes? Symptoms are the same.
Yes. Type 1 and type 2 diabetes, there is a difference in this, because as the name suggests, insulin dependent and non-insulin dependent. That is being tested with the help of response to insulin therapy. However, in most of the cases, it has been seen that, okay, doctors don't go into detailed type 1 or type 2. If given a choice, we can investigate that. Okay, by seeing the response to insulin. In most of the cases, we just titrate the sugar with whatever hypoglycemic medicines we have. Okay.
But doctor,
Fine.
sorry.
Okay, sir.
But the type 1 diabetes is only treated by insulin, while type 2 diabetes uses
Correct.
medicine. You cannot use medicine for type 1 diabetes.
Yes, for type 1C. So ideally what happens is, if the patient is found to be diabetic, we start with tablets, and the clinical judgment gives us an insight that the patient should respond to this tablet. And if the patient doesn't respond to the first line of treatment, then the doctor understands the fact that, okay, we have not got an adequate response. So we understand that probably the patient is belonging to type 1 diabetes and he needs rather insulin rather than the other tablets. So depending on that, depending upon the sugar level, see, that becomes a clinical judgment, more of clinical judgment rather than investigations. Okay.
Yeah, but that should, before someone goes to the dietitian, they should have that diagnosis done by a doctor, because this is very serious. Like the dietitian cannot. Yeah.
Yes. In that case, what can be done is, and most of the patients will have an ongoing medicines before they come to a dietitian. They will always have an ongoing medicine or a prescription.
Sir, the recording, it's gonna finish now, the session.
Yeah.